and today my PowerPoint will be discussing about interstitial cystitis. The history and overview. Because interstitial cystitis is a poorly defined entity of unknown etiology, the presentation is not uniform and the symptoms vary in severity and nature. This disease was introduced by a surgeon in Philadelphia called Joseph Parrish. He published the earliest record of interstitial cystitis in 1836, and he described 8 cases of severe lower urinary tract symptoms without the presence of the bladder stone. The term interstitial cystitis was coined by Dr. Alexander Skene in 1887 to describe the disease. The condition is part of a spectrum of diseases known as painful bladder syndrome. With interstitial cystitis, the signals get mixed up. You feel the need to urinate more often and with smaller volumes of urine than most people. Interstitial cystitis most often affects women and can have a long-lasting impact on quality of life. Although there is no cure, medications and other therapies may offer relief. It is also known as the pain bladder syndrome or the painful bladder syndrome. Signs and symptoms of interstitial cystitis. They vary from person to person. If you have interstitial cystitis, your symptoms may also vary over time, periodically flaring in response to common triggers such as menstruation, sitting for a long time, stress, exercise, and sexual activity. Most symptoms include a persistent urgent need to urinate, frequent urination, often of small amount throughout the whole day and night, up to 60 times a day, pain or discomfort while the bladder fills and relief after urinating. You also feel pain during sexual intercourse. You can also feel pain between the scrotum and anus in men, which is also known as the perineum. A vague sense of incomplete bladder emptying. Dyspareunia, sex-related distress, and decline in libido and orgasm frequency. You may also feel pain during sexual intercourse, as I just said, and a chronic pelvic pain. Some ladies feel pain in between their vagina and anus. The pain can also be a discomfort while the bladder fills and relief after urinating. The symptoms severity is different for everyone, and some people may experience symptom-free periods. Although signs and symptoms of interstitial cystitis may resemble those of a chronic urinary tract infection, there is usually no infection. However, symptoms may worsen if a person with interstitial cystitis gets a urinary tract infection. If you experience chronic bladder pain or urinary agency and frequency, just contact your doctor. Now let's talk about the causes of interstitial cystitis. The exact cause of interstitial cystitis isn't known yet, but it's likely that many factors contribute. For instance, people with interstitial cystitis may also have a defect in the protective lining, the epithelium of the bladder. A leak in the epithelium may allow toxic substances in urine to irritate your bladder wall. Other possible but unproven contributing factors include an autoimmune reaction, heredity, infection, or allergy. The main risk factors that are associated with a higher risk of interstitial cystitis are your sex and your age. Women are diagnosed with interstitial cystitis more often than men. Symptoms in men may mimic interstitial cystitis, but they are more often associated with the inflammation of the prostate gland. Most people with interstitial cystitis are diagnosed during their 30s or older. 2. Your skin color. and hair color, and also having a chronic pain disorder. Having fair skin and red hair has been associated with greater risk of interstitial cystitis. Interstitial cystitis may be associated with other chronic pain disorders such as irritable bowel syndrome or fibromyalgia. There are various complications that comes with interstitial cystitis, including 1. Reduced bladder capacity. Interstitial cystitis can cause stiffening of the bladder wall, which allows your bladder to hold less urine. 2. The lower quality of life. Frequent urination and pain may interfere with social activities, work, and other activities of daily life. 3. Your sexual intimacy problems. Frequent urination and pain may strain your personal relationships, and sexual intimacy may suffer. And the last one, your emotional troubles. The chronic pain and interrupted sleep associated with interstitial cystitis may cause emotional stress and can lead to depression. Since there are no proper treatment or cure for interstitial cystitis, there are various ways that you can manage your symptoms. 1. By physical therapies. Working with a physical therapist may relieve pelvic pain associated with muscle tenderness, restrictive connective tissue, or muscle abnormalities in your pelvic floor. Also, there are some medications that may improve the signs and symptoms of interstitial cystitis. 2. Self-care. Some people with interstitial cystitis find symptom relief from these strategies. It all depends on the diet change, the kind of food you eat. Your bladder training involves like timed urination, going to the toilet according to the clock rather than waiting for the need to go. Also, wear loose clothing that avoid belt or clothes that put pressure on your abdomen. Reduce stress. Try methods such as visualization and biofeedbacks. If you smoke, stop. Smoking may worsen any painful condition, and smoking contribute to bladder cancer. Exercise a lot by stretching may help reduce interstitial cystitis symptoms. Also, consult a doctor when you experience any of the symptoms. Urine cytology, which is your doctor can insert a thin tube with a tiny camera through the urethra, showing the lining of your bladder. Your doctor may also inject liquid into your bladder to measure your bladder capacity. Urine tests can also be a sample of your urine analyzed for signs of a urinary tract infection. During a pelvic exam, your doctor examines your external genitals, vagina, and cervix and feels your abdomen to assess your internal pelvic organs. Your doctor may also examine your anus and rectum. And the last one is biopsy, which is like during anesthesia, they use something called cystoscopy. Your doctor may remove a sample of tissue from the bladder and the urethra for examination under a microscope. This is to check for bladder cancer and other rare causes of bladder pain. Overall, no simple treatment eliminates the signs and symptoms of interstitial cystitis, and no one treatment works for everyone. You may need to try various treatments